Hi, good afternoon, Phil. My name is Anthony, and I'm a respiratory care student in Southeast Community College. Before I will start, can I ask for your complete name and date of birth, please?
Philip Fisher, 514 and 36.
Very good. So, let me do hand hygiene first. So first, I'm going to clean my hands with an alcohol-based hand gel. Then after that, I'm going to check my stethoscope if there will be no cracks on it. And I'm going to clean it with an alcohol-based swab. Okay, so I'm going to warm first the diaphragm, the stethoscope, before explaining the procedure. So what I'm going to perform is I'm going to listen for your breath sounds. So I'm going to auscultate your lung sounds in the front and in the back. So what you're going to do is you just have to sit upright, just relax, and all you need to do is just deep breathly through your open mouth. Would that be okay with you?
Yes.
Okay. I think it's ready right now. So can we start?
Yes, sir.
Inhale deep. Okay. On the other side. Okay. Okay, sounds good in the front. So I'm going to listen at the back. Can you lean forward a bit for me, please? So just inhale deep again. Then I'm going to listen on the side. Okay. So you can sit back again. So based on my assessment, your lung sounds are very clear. So I'll just have to document it in my chart. And now that I'm done, I'm going to do hand hygiene again. Ensure that my hands are clean. Is there anything else I can do for you?
No, sir.
Yep. Thank you so much and have a good day.
Thank you for coming.